This video is part of the mini-series within the larger course that we're creating for the International Chiropractic Pediatric Association, known as ICPA. This is sort of like a mini-course within a mini-course because this is an introduction to the comparison between the United States and New Zealand approach to childbirth education or childbirth preparation. And when you hear those different stories from World War II up to the present, you'll be able to compare your country or your region to understand why birth is the way it is and how we as consumers approach birth in our local area. However, it's really important first to understand, why do we have childbirth education? And is there a difference between childbirth education and childbirth preparation? And why did it start? And where is it now? And this is the benefit of old age, because I've lived through a lot of this. You actually probably don't know the history of childbirth education or childbirth preparation. Up until World War II, there wasn't any. And in one of the videos I made on the global health goals, you'll understand that all traditional cultures throughout time and place have always paid a lot of attention to pregnancy, and they have a lot of do's and don'ts. Medical profession pays attention in pregnancy with assessments, monitoring, procedures. The natural birth movement, which is very recent, just basically believes stop smoking, don't drink, eat well, and exercise. That's their approach to pregnancy. So what is childbirth education or preparation? When I gave birth in 1970 in the United States, and this was not true in New Zealand, there was a skills-based approach to childbirth. Classes were taught in almost every hospital, and they were Lamaze classes, which was entirely skills-based. The Bradley method, which was called father or husband-coached childbirth, was taught in instructors' homes and was geared more towards people interested in natural birth and home birth. And this was remarkable because there had never been any preparation for childbirth globally. So we attended 6 weeks classes, skills only, breathing, relaxation, and our husband learned to time contraction, pick up our arm to see if we were ragdoll, breathe with us, and encourage us. That was childbirth preparation. So we were preparing to do the activity of giving birth. In 1982, when I gave birth last, those classes were gone. Everything was childbirth education. It was giving us the information, the pros and cons of all the assessments, monitoring, and procedures that were now called interventions and applied to be imposed on us and unnecessary. And our goal in childbirth education was to create a birth plan because we knew what kind of birth we wanted. And when we created a birth plan, we'd be telling our birth provider, and we would expect them to try to give us the birth that we wanted. So I want to give you an analogy, which a lot of people have rolled their eyes about, but it's still probably the best analogy there is. Giving birth is like driving a vehicle. Why? Because 100% of people who are driving a vehicle have to be skilled. And giving birth is always an activity each woman is doing with her baby. Do women have skills? Not many. And that's because of the message. When a person thinks about driving, they think of two things. What kind of a car or vehicle would I want? And how do I learn to drive? So what kind of a vehicle is really about education. You learn about the different types of vehicles. You might learn about the parts. You might learn about when to take it in to get it checked and what are all the information you need about that vehicle. That's education. Education in driving can also be what route you're going to take. That's education. That's driving education. Driving preparation is when you sit behind the wheel of the car and you learn how to coordinate steering, turn signals, gas, braking, perhaps shifting a car, looking in their mirrors, and doing that safely when you're taking a trip. You may have marked out the trip informationally, but then you have to take that trip. And that trip is time-based, which means you start driving and you don't know what the road conditions are going to be like. Perhaps you'll hit a snowstorm or an oil slick or a child running out in the road. And that trip that you take, you don't actually know when it ends. It might be in 3 hours or it might be in 72 hours. And you can't stop. Birth is like that. It starts. If you're driving to the hospital to have a cesarean, that's when it starts. Labor can be vaguer. However, whenever it's sort of kind of starting, or when it clearly has started, you don't know what it's going to be like. My generation in 1970, with childbirth preparation, we had skills. When I gave birth in 1982, no one had skills because birth advocates and famous authors told us cows and cats aren't taught to birth. Women don't need to be taught to birth. It's instinctive. It's natural. We've always done it. We know how to do it. We just once again need to be left alone to discover birth. And our husbands should no longer be coaching or helping us. They should merely be supporting our choices. And so when we look at childbirth preparation and we look at childbirth education, neither of them are right or wrong. They sort of go together, don't they? It's great to have choices, which we lacked in 1970. But it's great that we have skills, which we all lack now. So in the 70s, I and hundreds of families I worked with brought forth a concept because the early skills-based methods were only geared to low-risk women and not to all of us. And they had 3 goals, which was natural birth, pain-free labor without medical care. And this brings us to understanding childbirth preparation and childbirth education from the viewpoint of the global childbirth goals that have existed throughout time and still exist today, even though we're not particularly conscious of them. The first goal is live mother. Women want to survive birth, and the likelihood is they will. Interestingly, until the 1980s, a live baby wasn't part of that global childbirth goal because throughout time, cultures knew that babies died in birth. They just didn't want a mother to die. And they knew that children under the age of 5, 20% would die prior to modern medicine. So live mother is the most important thing. And can childbirth education or preparation impact that? Well, the Webster technique and ICPA, that's part of their goal in some way, isn't it? To balance the pelvis and to balance the nervous system. And why is that? Because we want our baby to come down through and out our body in the most efficient and timely manner. And why is that important? Because prior to modern medicine, the 2 really scary things that would occur in traditional communities at birth was a stuck baby, and that baby would die inside, and then the mother would die eventually. And too much bleeding. Not necessarily the big blood flows right after birth, but the trickle bleed that would go on for days and just drain the woman's cardiovascular system. We can't necessarily deal with that in the modern world without medical care, but the stuck baby, certainly the Webster technique and our Birthing Better skills that focus on creating space, mobility, and softness inside the pelvis certainly can help a baby come down through and out the woman's body as promptly as possible. So that's the first global childbirth goal. The second global childbirth goal was suffering. As I talk about in the global health systems, modern medicine has always dealt with suffering by knocking women out or giving them pain relief. Today, it's epidurals. Traditional cultures accepted suffering because life was hard. It didn't mean people suffered all the time, but they worked hard and they accepted suffering. Life was hard a lot of times. The natural birth movement didn't believe that women suffered because Grantley Dick Reed, Childbirth Without Fear, and to today it promoted that if you aren't afraid of birth, you really won't experience pain. The third global childbirth goal was recovery of the mother and the baby, short, medium, and long term. The Webster technique, ICPA, and Birthing Better in their body work skills, the former done by a professional on you, and the latter done in the privacy of your own home and created mainly by fathers who knew that their wives didn't want to have long, exhausting labors and might want to avoid a cesarean for a long labor or a stuck baby. They just looked at a woman's body and said, big object in a container, can't change the object, let's change the container. And so they developed the Birthing Better body skills, which create space side to side, front to back, softening inside, including softening inside all of the birth canal, so that this big object can come down through and out the body without damaging it. How many women's bodies are damaged? And I can tell you a lot of them. And ICPA members know this. You work with them. Even the women who have had the most natural births might pee when they cough or laugh or run. They may feel too loose inside and not enjoy sex, or feel pain having sex, or end up with a prolapse of their bladder, or their rectum, or their colon, or their cervix, or their uterus. We know this. If we can prevent these things through good skills of preparing our body and good skills of managing our labor, isn't this well worth it? So childbirth preparation has gone out the window. Very few people are preparing their body for birth, and few people really are learning skills to do this one-off, infrequent, life-transforming, dramatic, and dynamic activity that 100% of pregnant women are going to do one way or the other, which is to do the activity of getting their baby out of their body. So when we're looking at childbirth preparation and education now in 2023, we want you and all ICPA members and everybody else who's listening to this to spread the word of the concept. We want this concept to grow. The idea is simple. The words are simple. The actions are simple. 100% of pregnant women are going to give birth. It's an activity they're going to do. Learn some skills and use those skills to work through the activity of birthing your baby. Now, what's important to know, if we look at those 3 childbirth global goals, live mother and now live baby, suffering and recovery, it is the reduction of suffering through skills that Lamaze and Bradley had such a profound effect on and positive impact on. And yet it was not recognized at all because the 3 goals of Lamaze and Bradley and Grantley Dick Reed were merely for low-risk women to achieve a natural birth, pain-free labor without medical care. They didn't focus on 100% of women. They didn't focus on the reduction of suffering. And that's a shame, because in my generation, multiple millions of us took Lamaze classes. And throughout the United States, obstetrical nurses and obstetricians absolutely loved seeing skilled families working together. And this is what I'll talk about in another video, a 1961 study done in New Zealand by H.A. Brandt that shows the same thing. Skilled women birth better, and the people who attend them love working with them. And the women know that they've reduced their suffering, so they feel better about their birth. So we can do this. We just need to spread the word. And also spread a handout. Make a list of all the skills-based methods and give that to people so that they can choose what skills-based method. They don't have to choose birthing better. They can choose Lamaze, Bradley, Grantley Dick Reed, hypnobirthing, hypnobaby, birthing within, calm birth, or any other skills-based method. We just need to grow a self-learning, skilled birthing population. And we need childbirth preparation and education to come together with a greater focus on the preparation part. Because here's the reality. It's nice if you have choices in childbirth. The majority of women don't. It's nice if your choices unfold the way you wanted them, but the majority of them don't. And it's nice if you get all the choices you want, but the majority of women don't. And therefore, what are we left with? We still have to do the activity of birthing our baby. And so we can do that activity better when we are skilled.